Recording. Okay, can everybody see my screen? Presentation good? Okay.
Yes.
All right. So we are here tonight for the Near Northwest Area Plan, which is a city or a neighborhood-wide vision, long-term vision for the neighborhoods of Chaffee Park, Sunnyside, Highland, and Jefferson Park. And we're here tonight to talk specifically about health and environment. So we find in these plans, there's lots of topics that get discussed, and if we isolate the topics, we can really achieve more in a shorter amount of time. So we are hosting 5 of these focus topics. This is the first one, so you guys are our guinea pigs. And tonight we'll talk about health and environment, and basically what we mean by that is really starting to envision, the next 20 to 30 years, how we can create a more healthy, healthy lifestyle for the residents of these neighborhoods, as well as, environmental sustainability. Really quickly, we do ask to do a demographic survey. The city of Denver is committed to broadening participation, and we really seek to speak to underrepresented community members. So we just ask that there's going to be a survey that pops up on the screen, and if you can just answer those real quick, and then we'll keep moving. So you should be able to see those questions come up, and they're just demographic basic questions. And while you're doing that, I'll tell you who's on the screen. I forgot to introduce myself. I'm Cheney Bostick with my firm Studio Seed. I'm part of the consultant team that was hired by the city to work on the Near Northwest Area Plan. And we have Edson Ibanez, who is a senior city planner with the city. And then we have 2 other consultants, Heather Noyes and Andrea Buglione, and I'll have them introduce themselves in the presentation. They each will speak about some of these issues. And I think Edson, we had 6 or 7. Was there 7 attendees when I started the presentation? So looks like 5 of you have answered so far. All right, 30 more seconds if you choose to answer the questions. If not, that's okay. Okay, let's go ahead and close the poll and keep moving here. So tonight we are going to, this is the agenda. We will briefly, as I said, go over these focus topics and set up the discussion for health and environment, talking about what we've heard so far in the planning process, and then some issues and opportunities that we've identified based on research and feedback. And then we'll go into small groups and have discussions about these topics, and then we'll report out and let you know how else to stay engaged, and we hope that you can help us spread the word. Just a reminder that this is Zoom, and if you are able, turning on video is always best, so we know that you're available and willing to participate. Mute when you are not speaking, Use the chat function if you have questions, and just a note that this meeting is being recorded. So the project timeline generally is here on the screen. The red arrow shows where we are in the process. So you can see we're in this second phase. It is a critical phase in the plan where we will be, we've identified these issues and opportunities, and we are working with the community during this time to develop draft recommendations. Once we get through this phase, which will last the next 5 to 6 months, we will go into drafting the plan. So there will certainly be other opportunities to give your feedback, but we are certainly happy that you're here tonight. This is a really important phase of the project. There is a lot of background information. So on the project website, which is hopefully where you signed up for this meeting and got word about this, and we will do e-blasts throughout the project to let you know when there are critical times coming up. But there are also these documents. There's an existing conditions briefing book that has a lot of data. If you are a data nerd and want to look at numbers and maps and things like that, that's a really good opportunity. We have summarized phase 1 engagement. So if you're just now getting involved and you would like to know, like, what we heard from people in previous meetings, you can download that engagement summary and look through that. And then we also have an issues and opportunities summary document. So there's lots of homework if you wish, but this process will also give you a good idea. And just please, stay up to date on the website. Make sure that you're signed up for the newsletter. There will also be online surveys, and that will be posted in the next week or two. So focus topics, these are,
just
these
real quick,
are,
the
yeah.
demographic polls is blocking the presentation. I don't know if the others are seeing this, it's just me.
Oh. Did it go away?
I'm just seeing focus topics.
Maybe it's just me.
Anna Claudia, you're a co-host, so it might have been, I think you can just X out the box yourself.
Oh, okay. I don't see that as an option, but I keep looking. Sorry to interrupt. I just thought others was being blocked too.
Yeah, that's okay. Thank you. So focus topics
Are we going to do introductions to see who else is on this meeting? Because I don't know everyone.
Yeah, we can do that. Since it's such a small group, we never know how many to expect. So I was going to skip introductions in case there was a big group, but yeah, if you'd like to stop, we can quickly do introductions. So I've started and I introduced our team. I'll just facilitate here based on who I see on my screen. So Pete, can you introduce yourself? Oh, unmute, please.
My name is Pete Tavani. I'm the general manager of RJS CJS, Robert Joyce Scavo, Carolyn Joyce Scavo, who own the property that Standard Fence used to sit on. And that's why I'm here. So I can get involved in the neighborhood meetings.
Thanks, Benjamin.
Howdy, I'm Benjamin Fuller, and I live in Jefferson Park.
Thank you. Gina.
Hi, I'm Gina Volpe, and I work for the Office of Councilwoman Sandoval. Born and raised in the north side, but on the west side of Federal in the Berkeley neighborhood, but here as a representative of the council office.
Hi, Gina.
Thanks. Lisa.
Hi, I'm Lisa Bardwell. I live in Highland, and I'm on the board of Highland United Neighbors, Inc.
Charlene.
Hi there, I'm Charlene Barrientos Ortiz, and I'm a Chaffee Park resident.
Thank you, Michael.
Hi there, I'm Michael Guzman. I live in Sunnyside. I'm also the captain for House District 5 with the Denver Democrats.
Thanks. Anna Claudia?
Hi, everyone. My name is Ana Claudia. I'm the West Parks planner for this area.
Let's see, Joan.
Hi, I'm Joan. I live in Chaffee Park and just interested in knowing what's going on in our neighborhood to make it more safe and a more livable place to be in.
Great. And Andrea? Andrea
Hi,
Rothschild. There's two.
Hi, yeah. Oh, I apologize. I'm driving, so I cannot be on video at the moment. I'm Andrea Rothschild. I am a resident in Sunnyside, and also a registered dietitian interested in improving the food insecurity in the neighborhood.
Great. We will talk about that tonight. And then we have some members of our consultant team. So I'm Cheney again with Studio C, part of the consultant team that was hired by the city to help them with the Near Northwest Area Plan. My focus is typically on architecture, land use, and design. And Heather Noyes, I'm gonna go next.
Hi, Heather Noyes, Studio CPG. Our focus is health and the environment, specifically parks, and also green infrastructure. Studio CPG is located in Northwest Denver near the intersection of Tennyson and 44th, and I'm been a resident of Berkeley for about 30 years, so I'm very familiar with all 4 neighborhoods in the study area, and looking forward to working with you all on this project. Thanks.
Okay, Andrea Buglione.
Hi, from North Cap Hill. I'm Andrea Buglione. I'm part of the consultant team with Denver-based Progressive Urban Management Associates. We're an economic and community development consulting firm. So I'm a researcher, urban planner, and community development specialist. Nice to meet you all.
And Edson.
Nice to meet you.
Hey everyone, my name is Edson Ibanez. I am a city planner here with community planning development with the city, and one of the members here with the Near Northwest Area Plan.
Okay, and Jennifer Bartlett, do you want to introduce yourself? She might be just listening in tonight. She's part of our consultant team as well. So I think we can keep going. I think that was everyone from the public. Thank you all for being here. So to carry on, the focus topics are unique topics that rose to the top as needing special discussions. In phase 1, our analysis and what we heard from the public. So things that kept coming to the top were things like, parks and recreation and access to healthy food and resources. So that's what we're here to discuss tonight. So we just, our goals tonight are really to have these topic specific conversations. So we will try to keep you on topic, and we'll make notes of things that are off topic, but we really wanted to stay focused on this health and environment, and have these small group conversations so that you all have a chance to share your voice and come up with ideas and strategies and tools. So tonight we'll present quickly in these 2 buckets, and then we'll have conversations in these 2 buckets, the 2 buckets being more about the physical environment. So what improvements to our physical spaces, our parks, recreation centers, streets, and open space can we make that could improve health and well-being of our residents and the environment? And then on the social aspect, the second bucket is more about accessing resources to improve health. So what additional resources can we provide to our residents that improve overall physical health and well-being? This is just a map of the DOT exercise, so that we had an online survey in phase 1, and we asked people, what do you like, dislike, and what are your ideas? And these have been filtered into what we're calling quality of life. So this is just showing where, you know, green areas are things that people like the neighborhood parks and open space and tree-lined streets. And then dislikes are kind of the circled areas in red, the red dots around here. The, you know, parks are outdated and need upgrades. And rec centers, people experiencing homelessness need facilities. Lack of convenient access to affordable groceries, highway pollution and noise. So these are, again, rising to the top in this health and environment category. And then you had some ideas, which I won't go through because we're going to get to lots more ideas tonight. I'm going to pass it over to Heather to walk through just quickly some data points to frame the discussion for the parks, recreation, and public spaces.
Thanks, Cheney. Just super quickly, and I want to remind everybody that your comments and your ideas are going to guide future funding. So as you move forward on these slides and into these discussions, keep in mind that we know you know your neighborhoods, and we're looking for your ideas and suggestions, which is really going to impact how funding gets distributed. We know that we need to improve the parks in these neighborhoods and the recreation offerings, not just by adding more things to each existing park, but more importantly, by thoughtfully expanding the park system. And within the near Northwest study area, access to parks and your 2 recreation centers is pretty good. This diagram on the right, where you see the pink within the study area boundary, that shows the gaps. So you have 2 gaps just east of Federal, one in Sunnyside and one in Highlands, and then up in the far northeast corner in the industrial zone districts. So when we start to look at parks, it's really important to understand the relationship of parks and recreation programming to health. And one statistic that popped out to the entire team is, and I'm going to share with you, is that the near Northwest neighborhoods have a higher than citywide average rate of childhood obesity in all 4 of these neighborhoods. The citywide average is 13.9%, and the neighborhoods here are significantly higher by a minimum of 5%. And so what that means is that our recommendations, your recommendations, really need to create opportunities that improve everyone's health, physical and mental health of all residents. Next slide, please. Thanks. So before I want to point out too, you know, parks really has to do with the amenities. What are the physical amenities in the parks? And then when we say recreation, that speaks to the programming and the activities that are available to residents within your neighborhoods. So there are a number of constraints to improvements and expansion of your park system in these neighborhoods. Some are obvious, some are not so obvious, but they really impact the type of amenities that we are able to locate in your parks. So a couple of items. The utility of your parks here is limited in 3 ways, and this is really important. Your parks here are small, and they can't accommodate a full range of program elements. Not every park can have a playing field. Not every park can have a playground. We're limited by the size of these parks. Many of the larger parks, such as Jefferson Park and your park up north at 51st and Zoonai, they're constrained by slopes, by the topography, and that also limits the kind of programming or amenities that can go in each of your larger parks. And then there's the City of Cuernavaca Park, which is a huge asset. It's 25 acres. It's a big community park, but it's located on the east side of I-25, so there are some access challenges there. Let's talk a little bit about acquisition, which is definitely possible. But if we focused on acquisition, what would that get us, considering the high cost of land in each one of these 4 neighborhoods? It would get us more small parcels, most likely with the same constraints such as slope and topography that limits programming. So we'd end up with more of the same at a time when we really need to diversify the offerings in this study area. And let's look at a few other components of your park system, which are the parkways, which are one of my favorites. You have Spear Boulevard, which is a Denver landmark going from the South Platte all the way over to Federal. It's on the National Historic Register, and I find that just a really amazing asset for the study area. And then Federal Boulevard is also a parkway traversing the entire study area from north to south. So let's look a little bit about what's outside the study area. What's nearby? What's in the bigger context? Well, 46th Avenue Parkway up north leads to the west. You've got Rocky Mountain and Berkeley Parks in the club in Willis Case Golf Course and the clubhouse at Willis Case. You have Sloan's Lake, and then you have the expanding system of riverfront parks all along the South Platte, just across I-25. And there's a lot here. There's an awful lot. And we need to ask ourselves where future investment will result in the most change and create the most opportunity. And that's really what we want to hear from you. Should we focus on connections, improving connections to the larger facilities? Can we expand the parkway system? What would a new modern parkway look like? These are questions that we hope to dive into with you tonight. Next slide, please. And then there are 2 other components that we want to consider: the environment, the tree canopy, and the hotspots or heat islands. That's the map on the right. Tree canopies on the left. They tell us, these diagrams tell us where we need to do better, where we can expand, where do we need to expand the urban canopy to fill in the gaps and also temper the hotspots. And regarding air quality, we're currently still working with the city to get additional data on that, but they've got multiple collection points set up within the study area, so we'll be able to report that back to you. So I look forward to discussing these topics in more detail with all of you in the breakout groups. Thank you very much.
Thank you.
All right, I'll take it over from here. I'll be sharing some of the information we've gathered so far related to healthy food access and some other indicators of community well-being. So really looking forward to exploring them more in depth in the breakout session, since we only really have time for a high-level overview. Next slide, please. Limited access to healthy food, particularly for lower income residents, is one of the most acute issues for the study area. You can see from this map, most of the study area households are not within a half-mile walk to a grocery store. And that's kind of an industry standard measurement in food access. Sunnyside is the most isolated, I guess you could say, with only 20% of residents within a half a mile of a grocery store. And also, this is not even factoring in how accessible that walk is. You know, there could be infrastructure barriers there. It's just one way to look at food access. Also important to note is that food access is more than just quantity of grocery stores. It's also about who is actually served by the existing stores, how affordable are offerings, are they culturally relevant? I shouldn't call out one store, but I'm going to anyway. The new Lever's Locavore on 38th, it's a great store, it fills a gap, but it doesn't necessarily serve the lower and moderate income residents. And this is something we've heard from stakeholder feedback. Through our analysis, we estimate there could be a grocery retail gap of around 100,000 square feet. And that's basically 2 average sized grocery stores. So one of our tasks is to figure out where and how to attract new stores, but also maybe there are other models of food retail we can consider. And we're excited to dive into that more. One more thing about food access is it's important to mention the role of non-retail food access providers. So think food banks like Bienvenidos. They're really providing key services, emergency food assistance, pop-up markets. And it's worth noting that many of these organizations are at risk of being pushed out of the community due to rising rents, changing neighborhood dynamics. And this is unfortunately probably true for other small businesses that, restaurants and other food businesses that the community values. Next slide. So it's really important to acknowledge that individual health and well-being is strongly related to access to opportunities and resources. And there's so many systemic factors that are beyond a person's control at play when we're talking about health. Access to economic opportunity can be a predictor of health outcomes. And this map is Blueprint Denver's access to opportunity map. The darker purple areas show more access to opportunity than most areas of the city. The rest of the study area is considered average compared to citywide. Within the near Northwest, there isn't necessarily equitable access to opportunity, nor to basic services, physical and mental health care, other basic needs. Just two more indicators I want to mention to illustrate these disparities. Average life expectancy. In Highland and Sunnyside, it's 7 years lower than that of the Denver neighborhoods with the highest life expectancy. So that's pretty significant. And life expectancy is strongly correlated with social and economic indicators like poverty level and educational attainment. Lead exposure, I think most of you may be aware that that's an issue in these neighborhoods. Chaffee Park residents have the highest potential for lead exposure with a risk score of 10 out of 10. That's according to the city's lead risk exposure score. Sunnyside census tracts score between 7 and 9, and the other two neighborhoods score slightly better. Next slide, please. We did an inventory of social service providers in the study area, including both formal and informal services and resources. Compared to other Denver neighborhoods, the near Northwest is slightly underserved in things like childcare facilities, public restrooms, libraries, urgent care centers, and pharmacies. I also wanted to point out that the study area is home to a significant concentration of churches and religious institutions, and these provide a pretty significant role in service provision. So emergency food assistance, shelter, rehabilitation programs, and a lot more. So they're just an important part of this informal network. And then finally, homelessness, it's a region-wide issue. It's hard to pinpoint exactly what gaps exist on the neighborhood level, but it's fair to say that the study area might not be adequately serving people experiencing homelessness. There's definitely some innovative supportive housing for people and families experiencing homelessness. The Regis Safe Outdoor Space Facility being one of them. But we hope this process can continue to explore additional solutions for supportive housing and other community needs. Next slide.
Great. Okay, so that wraps up just sort of some background information to get the discussion started. We have some targeted questions we will ask in the breakout groups. And Edson, since this is pretty small, I would suggest doing the 2 breakout rooms. And let's do at least 40 minutes. I would say we could do 45. So maybe go into the rooms until let's say 6:45.
Perfect. All right. So I have it all set up and you'll get a message right now.
Hi. Thanks so much for being here. I'm going to try to guide our conversation here. And I do have a document. I'm going to share my screen so we can all look at some of these question prompts. 1 second. Can you all see that? Okay. I'm
Maybe
taking
just
that
make
as a
it a
yes.
little bit bigger so that way.
Yes.
folks can see
Yeah.
it.
All right, first of all, recording's in process, right, Edson?
Yes.
Okay. Is there a volunteer who wants to help report out kind of what we discussed in this breakout group? Well, maybe it can be a group effort. So let's start with this Parks, Rec, and Public Spaces topic. Oh, Cheney is in that one, so here we go. 1 second. There we go. Okay, I want to go around now and everyone share what is one improvement in our physical spaces. We're talking parks, rec centers, streets, and open space that could improve the health and well-being of our residents and the environment. Everyone is gonna, don't be shy. So, Edson, would you like to throw an idea out there?
Oh, sorry. Can you hear me now?
I can.
So we're answering the question, what is one improvement to physical spaces?
One improvement. We're just gonna, yeah, we're just brainstorming.
One thing that I've heard a lot is dog parks. It encourages folks to like actually go to the park and interact with their neighbors more. And so that's something I've been hearing a lot from neighbors.
Yeah, because is there a dog park anywhere in the study area?
I don't think so.
Yeah, I feel like there's like spaces that people have kind of taken over as dog parks. But yeah, I think that's something we've heard.
Hi, this is Angelina. So the closest dog parks are, well, to me anyway, I live on 36th and Inca. And so the closest dog parks to me are the one over in Berkeley. And then the next official dog park is over by the skate park, actually, is behind the skate park. So people always use Cuernavaca Park as a dog park. There might as well be a no off leash sign or anything because people constantly use that there. And then there's a ton of people that just like any other smaller parks, or what I've noticed is actually a really big problem is any of the schools in the area are constantly being used as dog parks as well. And so
the pools, did I hear you correctly?
Schools.
Oh, schools.
Schools, yeah, those are actually being used as dog parks as well. And so people are not picking up after their dogs either on the school playgrounds.
Yeah, Angelina is correct about the dog park locations. We also wanted to do a plug-in that DPR, Denver Parks and Rec, also did a dog park technical update that does speak about the service gap for this area and something that can supplement the condition analysis for the dog park. On that technical update, master plan for dog parks does look at the north, like more the north area, like, Berkeley being a regional park, it does cover the service area quite a lot. But there is also opportunities and pockets that we can put it at edges of the northwest area that might be something to look at it, but it is very much location dependent, those analysis. And also the technical update also provides information about a community-led site identification that's going to be open up soon. So a great timing for this process to identify potential ideas and site identification for future parks. Does not guarantee that it's going to be a feasible location, but what guarantees that our eyes are going to be on it, and then something that the community can help us identify those and be part of the process.
Great. When is that process starting, Ana Claudia?
So that's TBD. It's coming up soon, but when we do open up, City Council gets notified, and then Councilwoman Sandoval does have quite of a community reach that she can communicate that, and we also communicate that through our means of social media and announcements. If this plan is still going on when the announcement is made, I can also let you guys know, so this group and this engagement is aware.
Great, thank you. Other ideas, thinking, could be super broad, a super specific idea to improve parks and recreation centers, open space.
So this is
Canopy.
Charlene, and
Hi.
hi there. I can talk specifically about the Chaffee Park area. I actually just moved from off of 38th and Federal where I grew up, but and now I live in Chaffee Park, but I will share a couple of things. And, as we look at the parks, we have Zoonai Park, which is an amazing park, very family friendly. Something that could be improved just at the park is the grass, right? Just we it's a lot of space, and lots of families do go there, but it's not really grass anymore. There's a lot of weeds, and I don't even know what to call them. So it's hard for the kids to roll around, and it's great in the snow because they could sled, but just looking at that space and replanting all of that, so that we can actually have, we can walk barefoot there. That's huge because the park's used a lot. The second thing about the park is that I'm curious about what the dog parks parks look like, because at Zoonai Park there are lots of folks who take their dogs there, and many people have leashes on their dogs, but it would be nice to have signage there, so that people pick up, after their dogs, and to keep them on leashes, because one of the things that's happened is that families will go, there will be big dogs there, and then they will leave because they have smaller kids that go on the playground. And so there's a privilege there. And I'll be real honest with you. They seem to be not family. They seem to be adults who are doing that. And the families who go there have little kids, and then the kids get scared. So, and I'm looking long term. So I'm looking at 5 years down the road. What does that look like? And it does take behavior change. And it takes up to 15 years, right? So what can we do in the next 5 years? So, and then I also want to share that right now, Zoonai Park, there is also, there are also people who are experiencing homelessness that are using the park to do that. So again, and I'm only looking at 5 years, because I think right now we're talking about what's possible. And in 5 years, there might even be bigger things that are possible, but these small pieces in the next 5 years could improve the physical space and even access to who would be going there. And then the third thing I want to share is that in our community, we're starting to see, at least in my neighborhood, we're like, ranch homes, and so one level, and you see, a couple of bi-levels, but we're starting to see scraping, and we're starting to see that gentrification that happened like 20 years ago in the Highlands area where I grew up, but we just called it the North Side. I'm born and raised in Northsider. So, and so when we think about physical space, and mental health, those are also contributors, although I know that you're looking specifically at these questions and what that looks like, but it is all tied together.
Yeah,
And
absolutely. And
what's
your concerns about gentrification are valid.
Yeah, so what's the stressors there? And then looking at those maps, those were phenomenal, and looking at them, and what are the services that are available to the community? I did not know about the obesity rates, and I do. I raised my children and now my granddaughter in the same neighborhood, so I didn't even know that was those were the rates. So good to know. So what does that look like even in the next, if we were looking at this timeline, and even in the next year and a half, how can we impact that? And then the last thing I'll share, and I'll just be quiet, but really, I think, where I live, we can walk to Zoonai Park. We can probably walk to Save-A-Lot, but if you're really looking at access, that's the only grocery store we have. you know, we have to drive outside of Denver to 84th and Pecos to go to the grocery store, or on the other side, which is fine. We have a car, but not everybody has a car in our neighborhood. So I'm actually just sharing that, you know, this is also part of the concerns of our neighbors. We do have families in our community, but who may not have that access. So I'll stop now.
I agree with everything Shar said. That's pretty much, I'm on the other side in Highland, on the edge of Highland, and I'm experiencing every single one of those.
Hi, this is Joni. One of the things I would say about Zoonai Park, we live about a block off of Federal, and I just find that Zoonai Park is a great park. You know, we appreciate anything we get, but it's not walkable from our side of Chaffee Park. And, you know, our communities are growing older, so I don't know that it really facilitates the older population in our area. It'd be nice to have a new playground. It'd be nice to actually have a rec center. The rec center that we do use is over at Scheitler. And even Scheitler could use some improvement. You were talking about walkable food access. I'm wondering, with walkable food access, does that, because I see a lot of my neighbors, my husband and I are fortunate enough to have vehicles, but we see our neighbors literally walking to the fast food restaurants on Federal to get their food, or they go over to Jenny's Market, which is a retail gas station that has a store, and they buy their groceries there. And I could tell you, I've been in Jenny's Market a couple times only, but I don't think they sell the healthiest of foods. And I think that really increases the obesity that we're seeing in our children. The other thing that I know that causes obesity in our children is, especially here along Elliott Street, where we're at, we get a lot of emissions off of I-70 as well as Federal, and a lot of noise, which increases anxieties in people, as well as increases their urge to eat bad foods. It also increases their risk of getting asthma, so then they can't exercise as much. Right now, 2 of my neighbors have small children on this side of the block. The kids can't really play in the backyard because they have garages back there. There's very little green space in their backyards for the kids. So the kids are playing in the front yards. And I was talking to one of the dads, and he's like, you know, right now we're fortunate because Village Inn is shut. But he's like, you know, if something else comes in, my kids won't have a place to play anymore because they're play in the front yard with the parents both out there watching them. That's the only way that they're getting exercise. And then they go over to Jenny's Market and they buy their food for the night, or they go over to the $5 pizza place to get a pizza for the night. That's why our kids are obese. That's why they're getting asthma. That's why we're not living as long. Because as you know, probably through research, I know I do research all the time in my job, that if you live next to an interstate, which we're between actually an intersection of 2 very busy highways, that increases our risk of death. It shortens our lives by at least 5 years, if not more.
Yeah, thank you for sharing all that. Anyone else on the topic of parks, recreation, and public spaces specifically? And then we will kind of pivot and talk more specifically around food and other health issues.
I'd also like to ask, I don't know what that is. My mom actually goes to Ashland all the time, and it's really hard for her to get in any swimming done, just because the pools seem to be packed. And people also don't want to share lanes or anything like that. So I know there's Berkeley too, but it's basically the same story, even though it's a little bit larger.
So this Charlene again in Chaffee Park, and I'll share that, you know, we go to Atzlan, which is across I-70. And again, I'm gonna, you know, talk about privilege and being able to drive over there. even if it's just across I-70. I hear, the woman who talked about, when there is some isolation on this side of I-70 from the rest of the city. That's the truth. And so we go over there, and it's a smaller rec center, and it is a neighborhood rec center. And so it's very kid friendly. And so we go there, and we really like that it's not packed, and that it is, I think part of it is because, it really does, it's next to housing projects, and it really helps with something in that community. I grew up in this neighborhood, so I knew how important these are, small things, but they're very important for kids. So perhaps, having something at that rec center, but not putting it on the grid, because then what's going to happen is that people are going to want to go there, and then the people it's meant for and that are limited are going to have less access. I mean, I think there's like this double-edged sword, right? There's the space, but if you start using it and you give too much to it, then people who don't normally go there will then go there. And then the folks who are taking advantage of it and using and utilizing it will then get pushed out. And it's it's a community who already has less resource and are invisible to some degree. So I just want to share that it's so weird, living off of 38th and Federal and then moving to this side at the edge of Denver. We have more interaction right on the other side of 50th than we even do in Denver. So it's kind of an invisible neighborhood unless it's a developer, people wanting to start to gentrify over here. So I, looking at those maps, it's like bittersweet. It's nice because people don't pay attention to us, but now we're starting to get attention. And when we even talked about getting a vaccine clinic specifically in this neighborhood, because we knew that that we didn't have the access that other folks were getting. And I'm talking about Chaffee Park, that we had to work and go to Guardian Angels, which happens to be unincorporated Denver, but it's still Denver, but doesn't get the resources. Anyway, so those are, for my neighborhood in particular, that there is that, unincorporated Denver, and like whose area is it really? And we're getting service outside of Denver and services outside of Denver.
Yeah, that's a good question in terms of the unincorporated Denver locations. I'm not actually sure the answer to that, but thank you for sharing those thoughts.
On the unincorporated topic, maybe something controversial but yet brave. Maybe it's something to think about. What is the process to incorporate that into Denver so these neighborhoods can start being serviced by a municipality? Like if it's not Denver, like who is the surrounding municipalities that can provide resources here? Again, controversial yet brave comment. Totally outside parks focus, but just putting out there.
Yeah. Anything else? Improvements, this kind of ties into what other ideas for improving physical mental health? Is there programming? Do you want to see more sports leagues or pickleball courts or better bike lanes, things like that? Just wanted to give you an opportunity to share any ideas before we move on to the other topic.
Well, here's something that I'm thinking outside the box a little bit. This is Joan. It would be nice to have some more green space up here in Chaffee Park. We're pretty packed in except for the one park that we have. And this is really thinking outside the box, but what would it look like if we had some green space along Federal? So when we do have people coming off of I-70, they tend to literally park in the parking lot there, at some of these gas stations, i.e. where Village Inn used to be at. There's times we'll have 4 or 5 cars parked there overnight, people sleeping in them and things like that, or just trying to take a break off of coming off the highway, you know, for 2-3 hours and taking a break. And maybe it would be better, not only for our health, but, you know, even the health of the people that are driving, to be able to get out of their cars, stretch their legs, you know, do a little bit of exercise, that kind of thing. Just thinking really outside the box there.
So when you say
Joanne,
green
can
space
you-
along Federal, do you mean like kind of the streetscaping and tree canopy and that kind of thing? More
Yeah.
like a corridor?
Yeah. I know, I think up at Adams County, they put in some more street dividers up in that area. But just to make wider sidewalks along Federal where people could walk. Maybe, you know, I don't know what else I could think of for walkability and exercise, you know, because people do come off of I-70 and they're walking their dogs inside that parking lot. I see buses where they're transporting kids between cities for basketball tournaments or whatever, and they stop there, and these kids are like walking in the parking lot where, you know, people have had their animals walking, and it's dirty, filthy, and it's like, you know, if that was my child, I wouldn't want them there. If it was, you know, myself that's been driving for the last 4 hours and I need an hour break just to, you know, have a release, it would be nice to have someplace to do that instead of just
Yeah.
having to walk it on the blacktop of a gas station.
You know, this Charlene, I love that idea. If you just look directly across, I mean, Regis did a beautiful job, right? That used to be a discount store, their parking lot. And what they did a beautiful job of putting greenery and putting a stadium there. And, you know, from I-70 to 50th or, you know, to Mary Crest, it doesn't even look like the Denver that I grew up in, right? It looks a little beat up. Well, it looks a lot beat up. So I agree with that woman. There's the dollar store parking lot that's, you know, man, that's a pretty good chunk of land. I don't know what's going to happen to it, but that would be beautiful to have something there where people can even just be together as a community.
Yeah, thank you, Charlene.
Joanne, can you expand what you mean by green space in Chaffee Park? I have a general idea what you mean. Green space can mean different things for depending who you ask.
Yeah, to me, it means that it's a place that anyone could go to walk. It wouldn't necessarily, I guess I would want to have like maybe bathroom facilities, you know, and wash up facilities, but I don't think it needs to have like a rec center type feel to it. I would love to have a rec center right on Federal, but I think that's, you know, wishing upon a star there. But I just think, you know, someplace where it's not another fast food restaurant or another gas station, because, you know, I keep hearing on our Facebook page for Chaffee Park that we're getting 2 to 3 more gas stations, that Village Inn is going to be taken down and it's going to be another fast food restaurant. I mean, those are the things that are not healthy for our neighborhood. And I think having more green space would be better.
Yeah, so Joanne, I disagree with you. Today is the day that you can put in wild dreams on the book, and if a rec center in Federal you think is wild, you know, you got to put out there to make it happen. You know, I've seen some communities bring up some very visionary ideas like this one here, a rec center in a key location on Federal. And it's not wild, it's just, you know, let's say out loud, and then let's use this plan as a way to vet this opportunity. That's very helpful. Another insight for you guys, DOTI, the Department of Transportation and Infrastructure, did a federal study. And even though Federal Boulevard is a designated parkway, it was not developed as a traditional parkway, as we all know. There is pockets of it that kind of like North Federal has some interesting pockets of that kind of like gives you a glimpse of what could have been. This is a good idea to a good time to think what a modern parkway means, because the zoning that's current in active right now kind of like facilitates for this type of businesses, gas stations, and what you see typically in federal. So there is already a overarching vision for it, but this NPI process can help define that further. So keep thinking and keep bringing ideas. And honestly, if you ask me, I think a rec center in federal is an excellent idea. They have big enough blocks that would likely to facilitate the size of facility that would be needed. And federal is is a CDOT corridor that acts like a highway in a way of their capacity. So in a way, accessibility would have been, pretty good from that standpoint.
Anna Claudia, am I capturing this right? I just want to be clear on the rec center idea. When you say Federal Boulevard, I envision the entire corridor. Where exactly are we kind of thinking?
I don't have any specific sites, this is non-site specific vision here, but I'm just saying, it's not a crazy idea. Let's look into it and see, if it is something that the community really wants and supports. Mm-hmm. And it doesn't hurt to bring it up as a feasible suggestion.
Great.
Also, if this recommendation is a final recommendation from the community, we'll look into it. And, it is, I cannot promise today that when and how will happen, which parcel will be a rec center. I don't have the answers for this, but what means, this plan will help guide our interest in finding a location if it is feasible and if it is a highly supported recommendation from the community. It has to start somewhere, and you guys can start this conversation.
Great. Awesome. Well, I want to pivot now down to this other topic. We have a little under 15 minutes left. So, and this is about accessing resources to improve health. I know it's a really broad topic, but the key topic really is around food access. So, but broadly speaking, let's do this exercise again. Let's all go around and just throw out ideas for additional resources that we can provide to residents that improve their overall physical and mental health. And that can include the food access piece.
Well, this is Joni again, the woman with the magic wand. I'd really like to see a grocery store over on our side of Chaffee Park, as well as, I don't know if we have any community kitchens or emergency food distribution areas. I know I volunteer for Denver Food Rescue, and I know Globeville has a kitchen that they have there for food rescue. Down south of Federal, where I volunteer at over on 23rd, it's very popular there, and it would be nice if we had a food rescue area here in Chaffee Park.
Yeah, great. Charlene.
Yeah, so there is that whole area where Save-A-Lot is, and directly across, some generations ago, it was like JCPenney's, and across the way there was Safeway, right? And so to look at those kinds of retail that are, well, I don't know if they're affordable, but that there's more selection for fruits and vegetables. There are these, like Stanley Market, they're starting to, in some communities, they have this big piece of land, and then they have these smaller vendors inside. kind of like a mercado, right? And so you go and you get, you can get what you need. So either one of those kind of designs, I just think that, I really appreciate you doing these meetings, because if we really do look at, what we could really look at, I would love to see my granddaughter in 10 years have fresh fruits, vegetables, and food, and good quality food, without having to go out of our neighborhood, and having her be able to walk to get groceries. That would help her with the walkability, that would help with what's in your community. It's an investment. So I would ask that the city do something like that. And looking at that, and there are just two big sections right off of Pecos. They are right off the highway, but there's these huge pieces of land that were retail, and that I would just love to see that.
Yeah, I like that idea, Charlene. This is Joni. Yeah, the Mercado style. I would love to have a Mercado in our neighborhood that's walkable for everybody to have, like you said, more fresh foods.
Benjamin, you've been quiet. Do you have any additions? If not, no worries.
On food access and health, I don't have a lot on food access. I have even less on food access and health, but I live next to the Safeway, so I usually just walk there. And to be honest, though, I can personally say I have no idea where people go for generalized health needs in the area.
Right. Yeah.
Like doctor's appointments and checkups and such.
What about community gardens? There are a handful, kind of like Highland, Sunnyside, Jefferson Park. I think the farther north you go up in the study area, the fewer community gardens there appear to be.
I would say with the community gardens, they exist, but they're actually really inaccessible. They're
Do you mean
very,
like there's a wait list, or like
there's a long wait list. It's really hard to be able to do anything there. You're lucky if you ever get a call. I've been on it for years and I've never gotten a call for it at all. So I don't know who to contact, nor like it's not really well publicized either. So just a little sign like really means nothing. And I have enough privilege to look that up, but not many people in the community do. So the community gardens are really hard to gain access.
So the community gardens that you see throughout the city is actually administered by Denver Urban Gardens, and they are the city partner that runs that. And I believe they recently changed leadership, and a new executive director. And I don't know if that changed some of these communication gaps can be resolved.
I'm sorry, can you tell me what that agency name was again?
It's not a city agency, it's a nonprofit, it's a Denver Urban Gardens. They are the one who runs the community gardens throughout the city.
Okay, thank you.
And you can find a lot of community gardens in parks. It's just they are our partner. They run it, and the details of their program can be debatable. How can it be improved? And I think providing them community feedback of the things that needs to be improved for increased accessibility is a fair game.
Yeah, and it's not to say that in the future Doug or Denver Urban Gardens has to be the only kind of entity that's really doing it. I think there are maybe opportunities to do more partnerships with the schools, utilizing their open space for gardens. Maybe there's opportunities for utilizing other public land or private lands.
And that actually goes back to the dog park situation, because there are schools like Columbia that have gardens, but then people are using the schools as their dog park. So then dogs leave, and then people don't pick up after their dogs at the school garden.
So this is Charlene, and I wonder if I'm looking at pie in the sky and big dreams. You know, before we started looking at neighborhood specific, we would look at bigger area specific, and there was a sense of community. And now I'm thinking about mental health and what that looks like, because as we brought in, the neighborhoods are important. I'm not saying that. I'm just saying it would be nice to have a bigger connection than just the neighborhoods, because when we do that, it does turn into the haves and the have-nots. I'm gonna, that's the truth. And so in areas when we don't have something collective, so I'm asking the city and county of Denver to look back on that and what that looks like. And I say that with goodwill and intention, right? When we used to talk about the north side and people belonging to the north side, we knew that whatever resources were in that area was they were open to everybody. They were not just neighborhood specific. So I just want to plant that seed, because that affects physical health, mental health, and it affects our partners, our neighborhoods, and even our relationships.
So you're saying like that sense of community really helps ensure that people kind of are aware of like different resources for mental and physical health, and people feel like they're supported. Is that what you're saying?
Well, that's part of it, but that that everybody's welcome, right? And as neighborhoods started to be identified, that was identified by money, that was identified by race, that was identified by resource. And so it did, there was a systemic racism that started to appear. It's good because it got pulled to the forefront. It's bad because then people who felt welcome everywhere realized that they were really not welcomed everywhere. But in the scheme of things in neighborhoods, people did feel welcome.
Mm-hmm. Yeah, totally. Anything else kind of on the topic of, I don't know, social cohesion, mental health, ways to improve the community that way?
This is Joni again. One of the things I see just in my little 2-block area here, where I'm at in Chaffee Park, is I'm probably the only one that actually looks to see what's going on in our neighborhood as far as meetings and things like that. And a lot of my neighbors don't feel comfortable doing Zoom meetings. They don't know where to look at. Like when I said, hey, there's going to be an organization meeting next week, they're like, oh, how did you know that? And it's a myriad of things. One of my neighbors is actually older than I am, in her 80s, and she doesn't know how to hook up to a Zoom meeting. She doesn't know how to find out when the neighborhood organization meetings are, because they're all through emails or actually it's on Facebook, and she's not on Facebook. 2 of my other neighbors are Hispanic, and again, they know how to do Facebook, but I don't know that they really feel comfortable joining into a meeting that they may not be able to understand, language insecurities and, having to ask for an interpreter, that type of thing. I think it would be very difficult to have to be in that position. So I don't think that they always feel welcomed into going into meetings, or even knowing what meetings are taking place, what the vision in the neighborhood is. I've been trying to keep track of what's going on across the street, and what, zoning they're doing. But even I have a difficult time trying to follow what's happening and what zoning changes are going on across the street from me. And personally, I don't want more zoning changes across the street, because they've been bad neighbors for years. And we have to, and I feel like, sometimes businesses get more of a break than what the actual people that are living in the neighborhood get.
Yeah, that's a really good point about just thinking about ways to make sure folks feel that there are multiple avenues for engagement, and, you know, that they feel welcomed and that it's not just all digital, you know, hopefully as this pandemic kind of winds down, that we're gonna go back to more in-person stuff, hopefully, you know. So we have about 2 minutes. So last minute opportunity for anyone to throw out an idea.
Did we say anything about bike lanes?
I don't think we did, no.
No.
Can we, so the, I would say they're not like, I'm thinking of like 32nd and Tejon where there's, you know, you can see it on the side of the road, but like nobody actually, I don't see bike riders actually follow any of those particular traffic rules. And then in addition to that, I don't know how we can regulate scooters. Like scooters are a huge problem in this area, and people leave them wherever they want, and there's no signage or anything that just, you know, and if it's a house that maybe is not a newer house, people just think that they can leave that there like it's trash and it's not worth anything when in fact people actually live there. Sorry, my dog is barking. It's because she always barks at the people who leave their scooters.
Yeah. We're good.
I want to agree with that statement, and 100%. You know what it sounds like when you talk about bike lanes and people who are riding bicycles, then you become an anti, and it's not that. Honestly, I appreciate the improvements that have been made in the community, but people also have to follow the rules, you know, and again, I'm going to talk about privilege here, because people think that they have privilege because of that. And at some degree, I think, you know, we just need to be honest about not everybody walks around with that privilege.
Mm-hmm.
All right.
That's a good reminder.
We are closing all the break rooms, everyone.
All right, you guys, thank you so much. This was a great conversation, great ideas. Now we're gonna go back to the main room and do a little recap, and then we'll let you all go.
And it just took me a minute to find the link to the Zoom meeting. That's all.
Okay, so you left the meeting on accident. Okay.
No,
we left the meeting.
I left the meeting, and then we had to leave the whole thing. We left the room, and then we had to leave the meeting. And then I put my window back to where the Zoom link was, and I had to get access into that. So
okay,
it was
so
just weird for a second.
Group 2, we're troubleshooting this as we go, since this is our first roundtable, but my group had a little bit of trouble getting back into the main session. That didn't seem to be the case for you all. Are you all back from your group?
Yep.
Okay.
I think, is Gina on?
Gina, no.
Gina's still in the break room, but it's about to close in 50 seconds.
Okay, so here she comes.
And then Joanne's still in the break room, but I can't move her over, but it's gonna kick her off in 40 seconds.
Okay. Okay. So in 40 seconds, and we've got about 12 minutes left, which is fine. We will go ahead, and I'll have, I think Elizabeth was gonna report out. Elizabeth, I took notes, and I will share my screen to give you some help. If you could just, from group 1, summarize kind of some of the big ideas, maybe one or two, big ideas from each question, and then we'll go to group 2.
Sure. Can you hear me okay?
Yes.
Okay.
Yes.
For the Parks and Rec Center, a lot of what I was hearing was bilingual education and accessibility, especially in the farther north neighborhoods like Chaffee Park. Additionally, working on access to the parks and the rec centers. So working on the bike lanes, slowing down cars in those areas, as well as fulfilling the sidewalk repairs that that I know the city has underway. So I think those would be our main takeaways. For physical and mental health ideas, getting the community together was definitely one of the ideas. So a community walk or run, as well as, and I think this came into kind of every element of what we talked about was sidewalk improvements, because the more we can get people outside, the better their physical and mental wellness can be. So I think that's my answer for that. Tree canopy and air quality, kind of connecting back to what I was talking about in the prior one, just there's a big problem with idling in the neighborhood. So especially when there's so much construction and in areas where there are restaurants or places that get, big shipments, the trucks tend to idle for a long time, which is a problem. And then obviously the more trees we plant, the better the air quality is. So we had a couple of suggestions around where those trees could go. Next, we talked about food access, specifically fresh foods and the food desert that exists from 38th to about 52nd, almost the entire east-west span of the neighborhood, with the exception of maybe one grocery store. And we had a big proponent for a co-op type situation. We also talked about the possibility of a community farm, and that would also allow residents to feel more invested in their not only their food access where they get their food, but in their community in general. And I think that covers good spot for a grocery store. We came up with a few ideas of partner organizations. So there's the Sunnyside Innovation District. There was a question about if there's a Denver Health Clinic or some other clinic in the area, and we weren't really able to answer that together. And then just working on our relationship with the schools in the area, including Regis and then down to Denver Public Schools as well, because that could be a big connector. Critical needs and services. We talked about addressing the needs of our unhoused neighbors. So just trying to help as much as we can in that regard, as well as mental health resources and bolstering transportation. So ability to walk, bike, and roll in the neighborhood.
Thank you, Elizabeth. That was great. And do we have a representative from group 2 that wants to do the same thing? I'll scroll down here.
Well, we never got a volunteer, so I'll just do it. And we kind of went rogue, Cheney. We just put all the conversation notes under this one key question and didn't go in the boxes. So, but the main takeaway, we spent a lot of time talking about dog parks and specifically the lack of dog parks, and kind of how a lot of the spaces right now, like schools and parks, they're kind of being co-opted. And just the issue of safety and dog waste. We heard that DPR pretty soon here is going to be leading a community process to identify sites for dog parks. So there's certainly an opportunity for the study area. Zoonai Park is great, but there's some improvements there. It's basic grass lawn maintenance, potential for new rec facilities. We talked about kind of the disparity between certain parks in neighborhoods for recreation space and the potential for maybe a new rec center along or near Federal Boulevard, TBD. We were kind of thinking big picture there. And also the possibility for more kind of streetscaping and greening corridors like Federal Boulevard and some of those large parking lots. So the next topic around food access and accessing health services. We all agreed that there's definitely a need for a grocery store, particularly in or near Chaffee Park. some ideas to explore are community kitchens and food rescue. We also brought up the idea of like a mercado style retail, or maybe with multiple vendors where people could access fresh food. And also the issue of community gardens, you know, there are some in the study area, but they often have long wait lists. So just more equitable access to food growing and looking for opportunities to do that. I think that sums it up.
Okay, great. Well, thank you. That was very helpful. And then I'm just going to go back to wrap this up, everyone. We wanted to share this final flyer that you might start seeing around your neighborhood. We've got some yard signs up. We have done some street campaigning through commercial districts in your neighborhood, handing out flyers. But we really need help spreading the word. For example, I think we had over 20 to 25 people sign up for this meeting, and then we only had 7 show up. So please help us spread the word to your neighbors, direct them to the website. Here are some upcoming dates. So next week, Tuesday, Wednesday, and Thursday, we have more roundtables. On Tuesday, we'll be talking about the industrial areas, so Chaffee Park and Sunnyside, and really talking about, you know, preservation of jobs and where industrial uses are intended to stay versus where we could mix it up in terms of bringing in new uses and rethinking some of those areas, particularly in Sunnyside. So Pete, that would be a great one for you to attend. March 16th, which is Wednesday. Great. Will be design, character, and preservation, which is always a hot topic in these you know, neighborhoods. March 17th, Thursday, is complete and green streets. And then the following week, March 23rd, we'll be talking about specifically on affordable housing and wealth building strategies for these neighborhoods. So we're going to isolate all of these topics and really get to dive into more detail with the community than we normally can. And then we'll have we'll have these online, this online forum for each neighborhood that's similar to how we did things tonight, but we'll focus on each of the 4 neighborhoods, and those are in April and May. And then we will have in-person workshops that are drop-in. They'll be 3 hours long, so you can come whenever it's convenient to you. They will be at the elementary schools and CEC Early College for Jefferson Park. So please try to attend these dates and spread the word and get people to come, your neighbors, and then engage on your own time. We'll have, as I said, online surveys and a question or a short video to watch on the website that will give you some background. That should be up in the next week or two. And I'll mention also that the neighborhood roundtables and the workshops will all have bilingual access. So Spanish speaking interpretation will be available for all of those. Register on the website, stay tuned in, and as Heather had mentioned before, if anything, you know, escaped you in this meeting and you forget and want to share more ideas, there is a contact on the website as well, and we welcome all of your feedback. So yes, Lisa, we will email you the flyer. Thank you. Thanks everyone for your participation.
Thank you.
Thank you, Cheney.
Thanks, guys.
Thanks. Good night.
Thank you, guys. Have a good evening. Bye.
Night.
You too. Night.
Good night.